Today, we're diving into a condition that's as serious as it is stealthy, endocarditis. It's this dangerous infection that hits right at the very core of our circulatory system, but you probably don't hear about it all that much. So let's figure out why.
I want you to just imagine for a second. What if an infection started to grow deep inside your body, in a place that's always moving, a place you absolutely need to live, and a place you just can't reach? Where would that even be?
Yep, we are talking about the endocardium. That's the super delicate inner lining of your heart chambers, and crucially, your heart valves. This is the battleground for endocarditis, and its location is exactly what makes it so incredibly dangerous.
Okay, so let's get right to it. What exactly is endocarditis? Let's break down what's really going on here. So at its core, endocarditis is a pretty severe inflammation, usually kicked off by bacteria, that sets up shop right on that inner lining of the heart. And you know what its favorite target is? The heart valves. You know those critical little gates that control every bit of blood flow?
So what happens when those valves get all inflamed and infected? Well, the bacteria, or even just the inflammation itself, starts to physically damage them. They get rough, they get scarred, and they can't seal shut the way they're supposed to. And that creates a massive problem.
And here it is. This is the single most important thing to get. If those valves don't close right, blood starts flowing backward. The heart has to work way, way harder, but is actually pumping out less blood, and that means less oxygen for your entire body. Just burn this simple equation into your brain. Less cardiac output equals less oxygen out. This one idea, it explains pretty much everything else we're about to talk about.
Okay, so if all this is happening deep inside your chest, how in the world would you even know? Well, luckily, the biggest signs can be remembered with a really simple and honestly kind of scary mnemonic: CLOT. The tricky part is that the symptoms can be pretty subtle. They can easily look like other, less serious illnesses. But they all trace back to that one core problem we just talked about: not enough oxygen and a hidden infection that just won't quit.
So this acronym, CLOT, it spells out the 4 major signs we have to be watching for. Let's dig into each one.
We're starting with C for clots, and for a very good reason. This is, without a doubt, the most life-threatening piece of the puzzle. See, those inflamed, damaged heart valves can actually start shedding little pieces of infected gunk into the bloodstream.
So where do these little clots go? Well, if one makes its way up to the brain, it can cause a stroke. But you can also see signs much farther away. Like, you might see these tiny little lines under the fingernails that look just like splinters. Well, those aren't splinters. They're actually tiny clots blocking up the smallest blood vessels.
Next up, L is for lung fluid. So think about it. If the valves on the left side of the heart are failing, the whole pump gets inefficient, blood starts to back up. And where's the first place it backs up into? The lungs. This leads to fluid building up, which causes things like crackling sounds in the lungs and a real shortness of breath. O stands for overheated. Now this one's pretty straightforward. We have to remember, at the end of the day, endocarditis is an infection. And what's the body's #1 go-to response to any infection? A fever. It's often one of the very first and most stubborn signs.
And finally, T is for too little oxygen. And this just perfectly brings us full circle back to our core problem. With less cardiac output, you get chronically low oxygen levels in the blood. And over time, this can actually cause physical changes, like clubbing of the fingers, where the fingertips start to get all rounded and swollen.
Okay, so we know what it is, we know what it looks like, but how does this infection even get started? I mean, how do bacteria find their way from the outside world all the way to the inner lining of your heart?
Turns out, the bacteria have a few surprising ways to sneak into the bloodstream. They can be injected directly, say through non-sterile needles. But, and this might surprise you, they can also get in through tiny little cuts in your gums during a totally routine dental visit. Even things like major heart surgery or a case of strep throat that doesn't get treated can create the perfect storm for this infection to take hold.
So let's think about this. An infection on a damaged, constantly moving heart valve. That sounds incredibly hard to treat. So what's the game plan? How do we possibly fight back against something like that?
Well, the approach is really a 1-2 punch. First, you've got to kill the bacteria. And this isn't easy. It takes aggressive, long-term, high-dose IV antibiotics to really get in there and wipe out those tough bacterial colonies on the valves. And second, you've got to fix the physical damage. If the valve is just too scarred up to work right, surgery to either repair it or replace it completely might be the only way to get the pump working properly again. Okay, to wrap things up, let's talk about patient care and prevention, because managing this condition takes some serious attention to detail. And we can actually summarize the key takeaways with another helpful mnemonic, MOLD.
So, MOLD stands for Monitoring for Any New Infection, focusing on oral care, letting all your healthcare providers know about your history, and, well, understanding the link between dental visits and taking your antibiotics. Let's zoom in on a couple of these.
Now, here's the piece of advice that is going to sound completely backward. When it comes to oral care, you'd think, cleaner is always better, right? But here's the thing. While patients should definitely brush every day, they are also told, and this is so important, not to floss during an active infection. And why is that? Because flossing can easily cause little bleeds in the gums, and that just opens up another doorway for bacteria to hop into the bloodstream.
Next up is L for Let All Providers Know. For anyone who's ever had endocarditis, this is absolutely non-negotiable. Every single doctor, every dentist, any healthcare professional they see has to know about this part of their medical history. And the reason for that is really simple: prevention. By knowing a patient's history, a doctor or dentist can prescribe a dose of preventative antibiotics before a procedure like a dental cleaning. It's a simple step that can stop a brand new infection before it even has a chance to start.
We've covered a ton of ground today, from that core problem of low oxygen to the signs, the causes, and the treatments. Your heart is an amazing, tireless machine. So as we close out, just think, what's the one key thing you learned from this explainer that helps you better understand how to protect it?